Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thank you for watching. I hope you follow our channel, and there's a button here somewhere for you to subscribe. We would appreciate that, as we almost have 20 million views. So if you do follow us, you know that I'm a cosmetic facial surgeon in Richmond, Virginia, and I do cosmetic surgery from here to here, and I don't do boobs, bellies, and butts. And I'm passionate about cosmetic facial surgery. It's my life. I love to teach. I love to operate. My favorite procedure is facelift surgery, and I did 110 facelifts last year, and we have an international practice. We see patients from all over the world. Now, one of the most common things that people want to know about facelift, of course, is the recovery, right? And you got to be careful, because a lot of doctors sugarcoat a recovery. I mean, it's real easy to tell a patient, oh, your recovery's a week. Then, they come back in a week and they're not recovered. They can't go back to work. And you say, oh, well, that's, most people heal. I hear all kinds of stories like this. You got to be honest with your patients, okay? So what do we tell patients? Well, first of all, everybody is so different when it comes to recovery. I mean, I see patients that at 7 days, they look great and they might go back to work. I see other people that it takes them 3 weeks maybe. So that's the bell curve, and the short and the long is over here. But in the middle of that bell curve, you have your 2-week mark. And I give, and my staff gives our patients, an estimate of 2 weeks. And what I tell my patients is to think about the 2-week mark. Okay, now this doesn't mean you're going to be totally recovered in 2 weeks, but it means at 2 weeks, most people can get out of their house, usually go back to work and do some light social stuff. Now, if you had a big wedding or reunion, I'd give yourself 4 to 6 weeks, okay? So you got to preface this by saying that, I can tell all of my patients with extreme accuracy about anatomy, about anesthesia, about medications, but how one patient is going to heal versus the next patient is all over the board. But this 2 weeks has been very helpful for us, as most patients are pretty good at that mark, okay? And we're going to show you a patient here in a second, do a little interview, and she's at her 2-week mark. This patient had comprehensive face and neck surgery, and I don't do any shortcut surgery. So she had a platysmoplasty, smastectomy, and standard facelift. She had buccal fat reduction. She had upper and lower eyelid surgery and a lower lid chemical peel. So we'll talk to her and see how she's doing at 2 weeks. And again, most of my patients are in this state at 2 weeks, some a little shorter, some a little longer. And what we'll do is, I don't want to wait 3 months to post this video, but we'll come back after this patient heals and look at her before and after pictures. And I will show you her before pictures today. So I hope this gives you a little idea of what to look for after facelift recovery. Now again, I did eyelid surgery and buccal fat removal on her, so that's a little bit more than just a facelift, but I hope this gives you an idea. Thanks so much for tuning in. I'm Dr. Joe Niamtu, LoveThatFace.com. So here we are, 2 weeks after upper lids, lower lid chemical peel, comprehensive face and neck lift, and buccal fat reduction. And the thing about recovery is it's variable, but there's kind of a standard, and we like to tell people that the initial recovery is about 2 weeks. So here we are, one of our favorite patients, and she's 2 weeks out of surgery. And I think she looks really good. She looks better than some patients at 2 weeks, but this is this is what we aim for, this kind of situation. How was your experience so far?
So far, I'm amazed that the most discomfort was the first 2 days, and after the third day, started to feel pretty good. And after a week, my husband had to slow me down because I felt good. And after 2 weeks, I'm feeling very good. So the first 2 days was uncomfortable, but.
And you expected that?
Yes.
Now, of course, this is not her final result. We're not even going to take her after pictures for 90 days. And she still has swelling, and we'll show you in a minute. We'll look at her incisions, but she's just doing great. And this is what makes me feel so good when we have compliant patients. They follow their instructions, they take care of their wounds, they eat well, they don't overdo it, and it makes everything come together. You're a great patient. We'll take a look in a second at her scars. So my staff and I take a lot of pride in our Facelift Incisions, because after all, that's the surgeon's signature. It's their face, it's my reputation. So I'm going to show you what we do. First of all, the sideburn incision is hidden in the hairline. And the posterior incision is also hidden in the hairline. Actually, you can see a little bit of it because she has her hair pulled up. But basically, when you look behind her ear here, you don't see anything. We take a lot of care to place these as best we can within the hairline so patients can still wear their hair up. You can see our incision in front of the ear. In probably the next month, you won't be able to see that. And the other incision is hidden behind the ear. Same thing. Our incision is hidden within the hairline, so you won't see it. A lot of people make their incision at the bottom of the hair, but then you see it. So we always try and camouflage it. Same thing back here. This incision goes back here, and you won't see it. Same thing. A lot of people, if the camera moves back here a little bit, a lot of people make their incision very low like that, and I don't like that. I don't agree with that because you can see it. This incision is hidden. So she's a great patient. We really look forward to looking at her 3-month follow-up. So the take home here is to have great results. You have to have a good surgeon, you have to have a great staff, and you have to have a great patient. I love what I do. I'm so fortunate to be able to get to come to work and do this kind of stuff with these kind of people. I'm Dr. Joe Niamtu, LoveThatFace.com. And now it's my honor to show you some clinical cases. And again, I have had the opportunity and the pleasure and the honor to treat over 1,100 patients with facelifts. So let's look at some of the results. And when you look at these pictures, I want you to look at the patient's jowl and the patient's neck and their cheek to a lesser extent. And I'll tell you, there's no better feeling than to take somebody with this type of aging and give them a natural, age-appropriate result, because that's what's important. You don't want a 78-year-old patient looking too tight. And again, getting rid of this extra neck skin and improving. And this is the before and after pictures of that same patient. On the left, it's before. The right picture is after. And you can see the way I do these incisions with the 3 arches just heal phenomenally. And I'm very proud of my ability to make incisions like this. Here's another patient, again, going from square to oval. And look at the jowl, look at the neck. The same patient in the lateral view. Look at the jowl, look at the neck. Same patient in the side view. And here are her before and after pictures. And if this is done correctly by an experienced surgery, the scars are usually imperceptible. Here's another patient with facelift only, and this is just a life-changing surgery for a patient with this type of profile. When we do liposuction and liposculpture and liporecontouring, we are actually permanently removing the fat in the face, so that fat will not come back, and we can really help sculpt these patients. This is the before and after pictures of that patient. Here's another patient with eyelid surgery and facelift. Look at the jowl, look at the neck. Here's the same patient, another view. And some of these people, when we get hollow and when we sag, we just become sad looking. And people say, Doc, my friends always ask me why I'm sad or why I'm tired. And you can see in the after picture we put cheek implants in this patient and facelift and lift everything up, give that oval appearing face and change their life. They look much more refreshed, youthful, alert, and awake. Male patients, very similar situation, improving the profile. Another patient with cheek implants and facelift. And this is just hereditary aging. This patient comes from a family where the females get this neck skin early in life. Another male patient, before and after facelift surgery. Another male patient, we did eyelid surgery, full face laser, and I believe cheek implants. So again, he started with wrinkles, but he didn't end with wrinkles. You look at his crow's feet and his cheeks because we did a simultaneous laser resurfacing. And here is that patient's before and after incisions. And I'm so proud to be able to do a surgery like this and have such great incisions and scars on almost every patient. Here's a patient that we treated. She saw another practitioner who told her that she had to lose 80 pounds or they would not operate on her. And actually, we performed upper and lower eyelid surgery, a chin implant, and facelift. And again, did a lot of liposuction and liposculpting, and great result and happy patient. Another male, look at the neck, look at the jowl. Another male patient, improving the profile. And if you look, you can still see his scar. That scar is probably about 8 weeks old and it should mature on its own. And if it doesn't, we'll go back and laser that and blend it in. This is a patient where we did brow lift, upper lids, lower lids, cheek implants, chin implant, full face laser, and facelift. So this is a very comprehensive case and what I consider a life-changing result. So I hope you've enjoyed this presentation, and I hope that my passion for face and neck lift surgery comes through in my discussion. And I also see so many people that really don't understand what a facelift does or doesn't do. And I think by watching this presentation, now you should have a pretty good idea exactly what does a facelift do and what does it not do. Again, my name is Dr. Joe Niamtu. My website is lovethatface.com, and you can see uh, similar presentations and many more things on my website. I have over 9,000 before and after pictures. I'm in Richmond, Virginia. Our office is 804-934-FACE, and I can be reached at niamtu@niamtu.com. I sincerely thank you for sharing your precious time with me and hope that you've benefited from this video.